Hallucinogens like LSD, psilocybin, magic mushrooms, MDMA, and ketamine are getting a lot of attention for their potential benefits in treating mental health conditions. Some clinical trials even suggest they can help with depression, PTSD, and addiction when used in a controlled medical setting. But what happens when people use these substances outside of clinical trials? A massive study looked at data from over 11 million people to find out whether hallucinogen use that leads to hospitalization increases the risk of death. The results are eye-opening. What did the study look at? Researchers focused on people who had an emergency room visit or hospital stay because of hallucinogen use. Then they followed these individuals for 5 years to see how their risk of death compared to the general population. They also looked at what caused these deaths and compared the results to people who had hospital visits for other substances like alcohol, opioids, and stimulants. What did they find? The study showed that people who had a hallucinogen-related hospital visit were 6 times more likely to die within 5 years compared to the general population. That's a huge increase in risk. In fact, 1% of people in this group died within 5 years, compared to just 6% in the general population. But here's where it gets even more concerning. When researchers looked at why these people were dying, they found that suicide risk was over 5 times higher than in the general population. Unintentional drug poisoning, like overdoses, was twice as likely. Deaths from respiratory diseases were more than twice as common. Even cancer deaths were nearly 3 times higher. This suggests that for some people, using hallucinogens in an uncontrolled setting can be really dangerous, especially for mental health. How do hallucinogens compare to other substances? One of the big questions researchers wanted to answer was, are hallucinogens safer or more dangerous than other drugs? The study found that opioids had the highest mortality risk. People who went to the hospital for opioid use had an even greater chance of dying than those in the hallucinogen group. Stimulants like cocaine and meth also had a slightly higher risk of death than hallucinogens. Surprisingly, alcohol-related hospital visits were linked to a lower risk of death than hallucinogens. So while hallucinogens aren't as deadly as opioids or stimulants, they're still linked to serious risks that people often overlook. What does this mean for you? Hallucinogens are often seen as relatively safe, especially compared to things like opioids or alcohol. But this study shows that for people who end up in the hospital because of them, the risks are real. One of the biggest concerns is suicide risk. Many people turn to hallucinogens looking for relief from mental health struggles, but if the experience goes badly, or if they don't have the right support, it can actually make things worse. That's why it's so important to approach these substances with caution. Unlike in clinical trials where patients are screened and supported by professionals, recreational use doesn't come with those safeguards. The takeaway hallucinogens may have potential benefits, but they also come with real risks, especially when used outside of supervised settings. This study is a wake-up call. If you or someone you know is struggling with mental health and considering psychedelics, make sure you have the right support and information before making a decision.